The semantic feature analysis uses semantic networks to stimulate the retrieval of words. The clinician will choose target words that are relevant to the client's interests to stimulate the identification of the semantic features. The clinician will introduce the feature analysis chart to the client prior to treatment. They'll explain the web of different categories and that the visual, stimuli, or the physical object will be described. During the treatment demonstration, you will hear these 6 categories discussed. In the first demonstration, the client will name the object prior to completing the semantic feature analysis chart. You'll see the clinician reinforced the correct production. However, she will continue to have the client continue to complete the chart in order to maximize all semantic features learned.
Hi Skylar, so today we're just going to work on some word finding, and we're going to do that with this activity where we have a web, and in this web you are going to put in different aspects of the different items I show you. So we're going to start with this item, and the first thing I want you to do is to describe it.
It's plastic, it's round, it looks clear.
Okay, how about we write that right there? Okay, the next part is, where would you find this item?
I think in the kitchen.
Yeah. Okay, so for the next part, when you see this item, what does it remind you of?
A bowl? No. A cup.
Yes, it is a cup. So now that you've gotten it, we're just going to also continue to find other aspects that you could describe this item so that it helps with your word finding.
Okay.
Okay, so what do you do with this cup?
I hold it.
Yeah? And how would you use it?
Use it to eat with.
Would you use it to eat with, or would you use it for something else?
To drink?
Yes. And then of course it's
a cup.
Yes.
In the second demonstration, the client is unable to name the object after completion of the semantic feature analysis chart. Should this happen to you in a treatment session, the clinician would continue and identify the item verbally. They'd ask the client to imitate, and together they would review the semantic features that describe their target object.
Okay, so for the next item, we're going to use this one, okay?
Mm-hmm.
So now let's start by describing it.
It's clear and it's round.
Okay. And then where do you think you would find this?
In the kitchen drawers.
Yep. And then when you see this item, what does it remind you of?
It reminds me of a fork, but I don't know what it's called.
Okay, well, we'll keep describing and we'll see if it comes to you. And then when you see it, what would you do with it?
And scoop things?
Yep. And then what would you use it for?
I know you use it to eat.
Yep. So this item is,
I don't know. I don't know what it's called.
okay, this item is a spoon. So this item is,
A spoon.
yes, and it's a spoon because it's round. You could find it in the kitchen drawer. It's like a fork. You use it to scoop, and you use it to eat.
Spoon.
Yes.
As a reminder of the prompt hierarchy, when the client progresses, the clinician will fade the use of prompts, cues, and visual aids in order to promote their independence.